Joining me now is Republican Congressman Doug Collins of Georgia, Vice Chair of the Republican Conference. Good to have you here, sir.
It's glad to be with you. How are you?
Thank you. I'm well. So let's start here. Can the majority leader pull it off? How will he do it? And are you optimistic?
Well, let's start with the last question first. I'm optimistic. I believe that the majority leader, do not underestimate his legislative skills. He's shown over the years that he knows how to get votes. And I think the one thing we have to remember here is most of these senators, when they came out, there's been a few that said there's just no way. But there's many of them saying, how can we get to yes? We heard the same thing in the House. This is about legislating, and I think that's what you're going to see this week. We're going to look at ideas, compromises. How do you get more votes to the table? And again, when we're dealing with a product such as Obamacare that is completely broken, it makes it more of an imperative, especially for Republicans, to come together, find a way to get this thing started and turned around.
So if the bill fails, what's the political fallout for the GOP as a whole and for President Trump specifically?
Well, at this point, I'm not willing to accept the premise it's going to fail. This is something we have ran on. This is something that the Republicans in both the House and the Senate have ran on for over 7 years. I think at the end of the day, the president, who is going to be working behind the scenes, he'll work as he has with the House to find solutions so that these members can get comfortable with what we're trying to do and also make the case to the American people that the system that they currently have has failed them. I mean, when you look at this is not only a Republican problem, but a Democrat problem. When you have over 160% premium increases in Senator Manchin's home state of West Virginia, when Missouri has over 140% premium increases, Utah 80-something%, and when you just go down the line, this is something we all need to come together on. So I think when the reality hits and we start looking at, do we want to move forward, do we want to help the people that saying we want to help, I think that's
what's going to point right now, right? I mean, the rubber's hitting the road right now.
It is, and I think we saw the same thing in the House. This is what legislating is about, and I think this is what a breath of fresh air has come in with this president, with this administration, also in the House and the Senate, to the American people. We're back to legislating. We're back to handling tough questions. We're back to moving forward, and instead of continually resisting and obstructing everything, Republicans are saying we're going to do what we promised, and I think that's what the president's leading on.
So with the walloping of the Dems during the recent congressional special elections, do Republican senators like Dean Heller of Nevada or Ted Cruz of Texas really have to worry come 2018 midterm elections, even if Obamacare repeal and replace is not achieved?
Well, I think what we saw, and especially Georgia 6 and across the nation, is again, these candidates ran on the fact that we're going to repeal and replace Obamacare. There's not been a theme change here, so I think the senators, understand that. They represent their states. They understand the political environment. And I think at this point in time, it's good news fodder. It makes great stories over the weekend. But in the next week or so, you're going to see the senators have to come down and make a decision. Do they want to keep their promise? Do they want to work together to find a workable solution that they put forward and then work with the House to make something we can send to the Senate, to the House, to the President? Or are we just going to sit there and do nothing? I do not think that's going to be their answer. And I think the special election has shown that this president is still popular among his base, and they expect us to keep our promises.
Once elected president, then President Trump said that, who knew health care was so difficult? Did you know?
Yes, it was something that we've been working on. Again, I've been in the House for just a few terms, but I mean, when you look at it, this is something that affects people's lives. The stories that we get here and basically some of the lies that have been told, especially about the House plan not protecting pre-existing conditions, not being concerned about people. Remember, the issue of Medicaid is something that we've needed to look at for a long time, and simply the expansion of Medicaid put on able-bodied adults into a program that was designed for the aged, blind, and disabled, and in many of those states, they were the ones pushed out. I don't think that's a very kind portrayal of Obamacare that most people want to talk about. So what we're going to have to do is find a affordable access to health care that men and women can afford, that they can use. Instead of just saying I have insurance, they can actually have health care. That's what we're working for in this planned overhaul.
Why has it gotten down to the 11th hour?
Well, I think in Washington, D.C., most everything comes down to 11th hour. It goes back to, I think, the premise of most Americans. We work better on a deadline. We work better when it's time to actually make those decisions. Most of us have seen that since we were in high school and college and beyond. So I think this is not new in Washington. We're going to see some work this week. We're going to see it may even push into the next week. I'm not sure, but I do know this. I believe that Majority Leader McConnell will get it done, and I think the senators will come along and see that this is the best thing, adding their input to make it even better.
So you say it may get pushed into next week. Are you okay with yourself and other of your colleagues going home if nothing is settled before the 4th of July weekend?
Well, I think that's the Senate's capabilities, but at this point in time, they'll have that choice. But I think this week, the main push is to get it done this week. I think the majority leader wants to get it done this week. We're supportive of that from the House perspective.
I understand whose capability is, sir. I just ask, what do you think about if nothing is settled this week? You and everyone else have to go home and focus and face your constituents.
No,
with no answers, no solutions.
Right. Well, we've been going home for a couple of months now as the House members and explaining our bill. I've been doing, talking to constituents on a weekly basis and even daily basis about this. And I think the senators are doing the same thing. They've moved a great deal over the past few weeks. I remember doing interviews just a couple of weeks ago to say, is the Senate even going to take up the bill? Well, now we know that they are and that they're working toward it. So I think at this point in time, let's watch what happens. And then I think the American people will be pleased, especially the ones who have supported the Republicans' idea that Obamacare is broken. This is a tragedy. And just like the president said, there are many people suffering out there. It's time for us to do something.
Well, that's for sure. Many people are suffering. The American people are counting on Congress to get it done. Congressman Doug Collins, thank you very much for your time this afternoon, sir.
It's great to be with you. Take care.